will let you all know that it is 9 o'clock and we do start 9 o'clock sharp. Everybody who's in our village square here, the attendees who are people are starting to join. There's Gloria Romero Roses, our board chair, saying good morning. And we invite you all to please do that. Share your resources, who you are, panelists. Panelists, I want you to know that there are many people who will be in attendance today who have been panelists before. We have leaders of organizations, lots of people who are working and doing amazing work, and they're here on this very special 10 Days of Connection Impact Collaborative. Jennifer, you're not local, so 10 Days of Connection is the brainchild of some amazing partners from the Children's Trust, Radical Partners, the Miami Herald, and others to bring people out of their comfort zones to go and learn about things and meet people that they wouldn't necessarily see in their automatic circle. So this 10 Days of Connection, we actually have Brianna from Sharsheret, who reached out to us after we met through the Jewish Federation. And so Brianna's co-hosting with us, right, Brianna?
We are. We're excited about it here at Sharsheret.
She said, we want to do it with the Women's Fund. And we said, we want to do it with you. So we're all here together. So this Impact Collaborative is focused on one of our 4 pillars, and that is women's health, right? Women's health, women and girls' health. This very particular one is not about just one simple aspect of women's health. None of it's simple, of course, but we're looking at various ways that we can inspire women to action to go ahead, Vivi, to the next ones. You know, we want to welcome people to take care of themselves. First, I have to welcome our Karina Castillo is here from the Miami-Dade Mayor Daniela Levine Cava's office. I know there are many other of our public elected officials and community partners with us here today, many direct service providers, incredible donors. A bunch of you just, you know, did a donation when you signed up here for the Impact Collaborative. It's wonderful. It's like a little vote of confidence. So we thank you, donors, large and small. And we actually, really brief, if you go on to the next one, fueling our mission with even larger capacity donors is a really fantastic way to support us with our grand mission. There's even a fancy QR code there for those of you who want to learn about some of the bigger funding that really helps us to all thrive and keep on coming together. And Caro is going to be posting in the chat as well if you prefer a link instead of the QR code. So moving forward quickly, Vivi will say that this Impact Collaborative series, which we all know and love so much because we come together to put on our gender lenses to share and thrive and get to know each other better because we're on one focused topic, that is empowered by the scale of family and 1 billion rising. So all together in solidarity. We're coming together today to talk about women first, a very difficult thing for many women to do. And I understand there are many reasons, but if women are not healthy, we can't be around to take care of everybody else. So this is one of our past public awareness campaigns, and that's something the Women's Fund, one of the things that the Women's Fund does very well. We work collaboratively with you all to hear what the needs are going on in our community and help focus solutions and always a place to go to. In this case, it was a campaign we drove people to 211. We're tying a thread to our last August Health and Wellbeing Impact Collaborative, which was the first time that the Women's Fund tackled climate and how it relates to women's health. This is an emerging issue that's being recognized globally, but it is a tip of an iceberg, something we're still learning so much about. The 4 brilliant panelists that you see on this slide were speaking, much like you all will today. Dr. Tom's partner in crime, Dr. Cheryl Holder, and these panelists were all here together. If you go to the next slide, we'll see our keynote was given by Dr. Amy Clement. And Dr. Clement not only gave us a lot of amazing information, but she said, this was fascinating. this is important. Will you please come and present to the Climate Resilience Committee meeting for the city of Miami? So another one of the panelists, Sky Wheeler from Human Rights Watch, took the time to work very closely with Viviana Alvarado Pacheco from our team and work with all of the other panelists as well, but to collate all that information to take it to the Climate Resilience Committee meeting and present some recommendations on how the city could help put a gender lens on women's health. It was not purposeful that we didn't know we'd be so successful, but we were, because what happened was Chief Robert Evia from the city of Miami, the city emergency manager, invited the Women's Fund to come and speak to them. He said, yes, we should be putting a gender lens on some of our emergency response. And very long story short, that did happen. So now the city emergency response information includes a gender lens about women in pregnancy, and the amazing Mayor Daniela Levine Cava has given direct and very clear and capacity building instructions to her entire amazing team to do the same for the county. Amazing civil servants who are working with together. If you can go forward, then Viv, this is the public awareness campaign that will be launched on May 24th. In advance, that's the Monday, there'll be a big press conference with our Mayor Suarez and members of the county, we believe, as well. Everybody's working behind the scenes feverishly, pun intended, to get together to work on women and heat, and to support this campaign around May 28th, which is National Heat Awareness Day. These are the bus shelters. We have 2 different versions. And then we also have versions, of course, in Creole and in Spanish, because we do need to go to people where they are. Another one of the themes of how we communicate today. Speaking of fuel, look at that logo, that little pineapple there, is because this campaign is being sponsored and paid for by Baptist Health, enabling us to do this first launch. And we do need continued funding to keep these public awareness campaigns going. So any of us in our very extensive realms, both in the audience and on the panel, we're welcome. We welcome this to be continued. I also want to point out there that we always have a driver, and currently the information is on the City of Miami emergency homepage. There are many places that this information could grow to and go to. So that is also interchangeable. We can go forward and add more calls to action. The messaging that is on here is not the Women's Fund messaging alone. There was a heat messaging group that Viviana put together with Sky Wheeler, Dr. Toms, and many others opined and gave their okay to, these are the drivers and this is the messaging that we should be using. We bring experts together, identify issues that are going on, and work collaboratively. And this is the fruition, and it will change this time next year. It will be even bigger and better as we keep on coming back together. So moving forward to our brilliant, amazing, fascinating, interesting keynote speaker. And I'm saying that because I want you all to get as excited as I am. I want you to all feel like you are mining today. We have one of the great thought leaders, thought-provoking leaders, joining us from New York today, from NYU, Dr. Jennifer Jaquette, and she is going to give us tools and stay with us till the very end to talk about how all the messages that are so strong and amazing that our panelists have today can be heard. Dr. Jaquette, take it away.
Thank you so much for having me. Good morning, buenos dias. And I don't live in Miami, but I've spent a lot of time there, and I'm really thankful to be joining you all today and learning more about your great city as well. I had a wonderful discussion with the women of the Women's Fund, and they actually got me to think about my recent research through the lens of gender, which you'd say, like, well, hadn't you already done that? But I really hadn't thought about it in depth. And so today are just some sort of preliminary remarks along those lines. And the book project I just completed is about how the private sector has challenged scientific knowledge. It's sort of a history of that strategy. And I think we tend to think immediately of the climate example or the fossil fuel examples because that's been very prominent in the media. But it actually started with issues of worker safety in the asbestos and lead industries. And in fact, in the lead industry, it was and radium. And it was in the radium industry that women were responsible for painting the dials on clocks, and they were experiencing higher rates of cancer as a result of radium exposure. And the industry, sort of subverted and challenged that scientific knowledge. So right at the very beginning, women are prominent in this story. Then the challenge and the disinformation and the pushback against scientific knowledge moved into consumer products, of course, like cigarette smoking, which again, women played such an interesting role in because there were massive PR campaigns in the early parts of the 20th century to get women to smoke. They hadn't previously smoked. And part of the rhetoric to get women to smoke was around freedom and equating cigarettes with freedom. And then, of course, the latter part of the 20th century, we see this environmental body of knowledge coalesce, especially around climate change, but also human health questions and things that are disproportionately affect women, like endocrine disruption. And we again see a sort of concerted, strategic way of pushing back against science that was coming out of government and universities. So in my work, I've identified 4 sort of main ways in which the private sector in particular has pushed back against scientific knowledge. So they've challenged the problem itself. That's pretty rare. But of course, we saw that with the fossil fuel industry challenging the very existence of climate change. Challenging causation, in other words, arguing that, let's say, the pesticide or herbicide that you produce does not actually lead to the harms or human health crisis that scientists have identified. Challenging the messenger of those, both scientists, journalists, and activists of those findings, and challenging the policy. But I just want to drill in, we don't have much time, so challenging the messenger through this gender lens. And again, there are 3 types of messengers. You can, journalists, activists, and scientists. And so I started thinking about these 3 categories. And of course, there are civil society groups, and there are, now people in banks, and this was a useful way of thinking about these three bins, especially in an 8-minute presentation. And so I started thinking, do the women journalists I know experience anything sort of odd or disproportionate compared to the men that I've been researching? And I have to say that a lot of the tactics seem pretty similar across genders. So you can think of someone like Carrie Gillam, you can go to the next slide, who is accused often of lying often. But that, while that may sound potentially gendered, you can also find those accusations toward Eric Lipton at the New York Times. But Carrie Gillam has experienced a lot of pushback. She has written books and challenged, and through her journalism at Reuters, it challenged Monsanto especially. And this was a court order that Monsanto issued, or a request to the courts in California, asking that her book actually be barred from being presented as evidence in a recent trial against Monsanto. So you can, that again happens to men journalists as well. But, I was sort of trying to think of, what's happening across these gender lines. One thing that, one thing that I've seen that does seem special to her, I don't know if that's because she's a woman, is a 20-page document. I circled it down here, a strategy plan to combat her book before it came out by a PR firm. So 20 pages trying to undermine the credibility of her book, Whitewash, the Story of a Weed Killer, Cancer, and the Corruption of Science, published by Island Press in 2017. So in advance of her book even being published, there was a concerted effort to discredit it through blogs, private media, radio. And then, of course, she got her hands on, as she often does, the documentation of the strategy. Then if I think about activism, another category of messengers, I think of, the photos you showed right at the beginning, and someone like Jane Fonda comes to mind. And one common, activists are sort of harder to disparage or undermine the credibility of, because they sort of come in with very little credibility to begin with in some ways. They're seen as subversive to society. It's very hard to sort of discredit activists in really meaningful ways, at least what I've seen through history. But one common turn of phrase is a sort of, there's nothing new here. There's nothing new. And I thought about that with regards to Jane Fonda, who of course has been an activist for so many decades. And I found this quote by former President Trump about how, look, she's getting arrested again at, every 25 years they arrested. There's nothing new here. Nothing changes. It's just Jane Fonda trying to get attention. And the accusation of activists being publicity hounds is something we see also through the ages. And there actually have been historically many women journalists as well as women activists through these cases. Where women really stand out to me as having a different experience than men is actually in the field of science, as scientists. And it'd be interesting to get Dr. Clement's perspective on this from her own work. But Rachel Carson is sort of the lightning rod example of this after her release of Silent Spring, the book about chemical manufacturers, where in almost every negative review, you can really see a gendered response to her work. So she's called a hysterical woman, a spinster worried about genetics, how you're never going to satisfy emotional women in garden clubs. The word emotion comes up so often in her negative reviews that it's almost, a kind of trope. They called her work unfair, one-sided. That's normal to see across genders, but hysterical is another one of those gender-charged words. Again, emotional, and then mystical attachment to the balance of nature. And she was not the only one to experience this kind of language, although it was most intense for her during this period. Another scientist named Theo Colburn, who also worked on endocrine disruption, experienced similar kinds of backlash, although not to the same degree. And part of me wonders if it's the ambiguity of gender in her name. Theo Colburn is sort of an ambiguous kind of name, and I think it was that may have played part of it. Anyway, moving on to more the present day, if you think about how then the industries, acid rain, fossil fuels, tobacco, pushback against acid rain. There's been great books written, including one co-authored by a woman, Naomi Oreskes, about these merchants of doubt, independent scientists hired by industry then to work on these various issues. Some of them worked across these issues. She identifies a handful in the book, all men, almost all physicists, all very much of a particular ideology, which was very anti-communist, coming out of a Cold War experience. And what's interesting about these merchants of doubt, of course, that you'll see right away, they're all men, they're all white, and they're all of a certain age, and they're all of a certain disciplinary training. Now, that was the typical trusted scientists, particularly through the 50s, 60s, 70s, 80s. Times are changing. And of course, women have joined the scientific game in a very big way. You're seeing that. You've seen it on the last panel you had. There are now women merchants of doubt as well. And you have someone like Judith Curry, who left academia to have her own private consulting firm, basically, because she has challenged to a large degree the consensus position on climate change. Sarah Place, I'm very interested in. She trained under a man named Frank Mitloehner at the University of California, Davis. And now she represents the science behind sustainable animal agriculture and works for the National Cattlemen's Association and is working on the science side of that. And so as you see the field of science changing to accommodate, of course, people with more diverse backgrounds, including women, we're also seeing the strategy to hire scientists to challenge the mainstream science also reflect that same kind of diversity. Next slide. In the world of activism, this is also true, of course. So now one of the most prominent climate activists in the world, Greta Thunberg, is 16-year-old when she began in Sweden. This is me on the right. I got to meet Greta before she was super big. This was just one of her Friday strikes in Stockholm. My colleague Henrik Osterblom there on the side. And so this was before World Economic Forum and her meeting the Pope and coming to New York. But she became very well known, of course, for this Fridays for the Future idea. And in fact, she is cited as the inspiration for Jane Fonda's efforts. She has become so prominent that, next slide, please, the Heartland Institute, which is a think tank and has been funded enormously by the fossil fuel industry and is considered one of the primary conduits of climate denial, hired this girl, Naomi Seipt, from Germany. She was 16. She was called the anti-Greta, and she has challenged in a variety of ways Greta's rhetoric and sort of is going toe to toe with her in a particular style. So she has Instagram accounts, releases YouTube videos, is trying to reach the same audience, has not been as successful by Greta at any case, but it's just interesting to see how you find the tools being, sort of, oh, okay, do we want a 16-year-old girl from Europe? We'll find a 16-year-old girl from Europe, if that's the voice that people trust. All right, and wrapping up, the oil and natural gas industry has been called out for its lack of participation by women in the industry, and they are working very hard to right that wrong. And they have a lot of campaigns about how women are essential and desired in the oil and natural gas sector. So there's lots of various advertising. Keep your eyes open for that. But one story that I really liked that came out, I think it was last year, was a whole expose on a PR firm that had designed a site on the women who love natural gas. And it was a bunch of testimonials and photos. And this journalist found that the photos changed every month. And then that one of the photos was actually a executive from LinkedIn. And so these were grabbed off the internet. And they also have the same PR firm, I think it was, created an Instagram site that, again, equated natural gas to women's issues, like beauty comes in all shapes and sizes with these various oil rigs. And so when it comes to these issues of, let's say, scientific disinformation, I really have identified a few areas where I think improvements, or at least this gender lens, would be helpful. One is that reporters should hopefully get very engaged in looking at the funding sources and potential conflicts of interest in the scientists that they quote in their articles. That goes for men and women. And industry grants that scientists receive often come with a certain set of conditions. It's worth digging into those. But also for those of us who are, not in the media landscape and don't have that kind of authority, I think just watching for the way that gender is being used as a tool is important, and to be on the lookout for ways that disinformation might be using gender to promote their products, their position, or a new term that I really love, woke washing the public. So thank you very much for having me today and forcing me to think about my own work through this lens.
Well, you're staying with us, and Jennifer's going to help us during the Q&A and play with this, then how the different panelists and the people in the audience can help get their messages across, right? So we've got some playing that we can do here. I have to say that not only did the Miami Herald, I think they're on with us today. I know they are RSVP'd because they're very concerned about getting the information right. They were going to join us, but I can't even, please, everybody who's in the audience, tell people who you are. We've got the heads of amazing organizations, Cleo Mindfulness, Jane Gilbert herself is here, Debbie Bustle's here. Our board members represent so many important high leveraging organizations and individuals. So I'm not going to mention everybody. Mom's Clean Air, please say hello in the chat and share. I mean, it's amazing how much we can amplify after an impact collaborative like today. So please do. So how is this going to work? We are now going to go to our panelists, but we're asking you to participate not only in the chat, but also doing the polls. And please ask your questions in the Q&A box there, and I'll try and grab them and get to as many of them as we possibly can. Now I'm going to ask each speaker to introduce themselves and they're all amazing, so under 2 minutes and in context of today's topic. And we will go in the order that you'll see on your slides. So Tanisha, I'm so excited to have you here. Welcome.
Thank you very much. I'm so excited to be here. And again, like you said, it's such great networking, such great collaboration. There's so many great organizations on this call, and we all can do amazing work together. So thank you so much for inviting me to speak today. So my name is Tanisha Amen. I am the Director of Maternal and Infant Health and Collective Impact with March of Dimes. The Collective Impact is a new initiative that March of Dimes has implemented in Miami-Dade County, and it entails bringing together multi-sector partners to solve complex issues. And so the work that we do is centered on education, advocacy, and public awareness. Our overall goal is to conduct a deeper data dive, and we're going to analyze this data to drive decision-making and engage partners around a common agenda. That's the most important part, being on the same page so we can all work toward the same goal in the same manner. So our CI work will use this data to create public awareness around women and infant health issues and focus on action-driven results. And lastly, I just want to say, I think it's very important that we use this collective impact framework, because in order to address maternal and child health challenges, because no single organization can do it by themselves. It's a really collective initiative to reduce the inequities in birth and maternal health outcomes. And so, and this initiative that we started with the March of Dimes, we just want to make sure that we are including all the organizations because everyone has valuable input in their own way. And we want to ensure that everyone is making an impact in the work in trying to reduce these rates in Miami-Dade County. Thank you.
We are so with you, Tanisha. Perfection, perfection. 10 Days of Connection partner in positive crimes. Brianna Schwartz, welcome.
Thank you so much for having me. I'm Brianna Schwartz. I'm the Florida Regional Director for Sharsheret. Sharsheret is a national not-for-profit organization which improves the lives of Jewish women and families living with or at increased genetic risk for breast or ovarian cancer. We provide psychosocial support for those who are facing cancer and life-saving education through community outreach. So programs like this today, where we have the opportunity to talk about issues that Jewish women and families are facing, specifically with a genetics lens, we welcome the opportunity to partner with organizations like Women's Fund and March of Dimes and all the other amazing groups that are on here. So in the context of today's topic, I'm going to be speaking about, the challenge that I want to discuss with everyone is the impact of COVID-19 and cancer, and how that plays a role in our population and what genetic risks are associated with breast cancer and ovarian cancer, specifically in the Jewish population, but in other populations as well.
Fantastic, fantastic. And how we communicate. Leonie, so happy to have you with us here.
Good morning. Pleasure to be here. My name is Leonie Hermanton. and the Director of Communication, Development Communication, it's a long title, and Strategic Planning at Santla Haitian Neighborhood Center. Santla is a community-based organization serving, located in North Miami, what we call the Northeast Corridor, which includes Little Haiti, North Miami, and North Miami Beach. Our mission is to strengthen, empower, and uplift the Haitian community of Miami-Dade County. We serve over 11,000 clients a year, a number that has dramatically increased because of COVID and because we remain open throughout the pandemic. Over 50% of our clients are women, and we serve them in multiple capacities. We provide access to public benefits, healthcare, employment, parenting services, mental health services, information and referral. And, we communicate, one of our, in addition to serving clients directly at the center, we'll also provide education through multiple mediums, television, radio, and now increasingly Facebook. We also don't forget WhatsApp, which has become a major mode of communication for the women in our community. Thank you.
Thank you. I get chills for all that you all do. It's spectacular. And there's going to be so much that's going to be shared from today. Dr. Toms, thank you for being here.
Hi, everybody. I'm Catherine Toms, and I just wanted to thank the Women's Fund for inviting me. Hi to Maria, Vivi, and Carolina. You're great to work with. I'm a public health physician. I have experience developing initiatives to reduce maternal and infant mortality by addressing health disparities. I'm originally a Miami native and relocated to South Florida in 2019 when I joined the steering committee of Florida Clinicians for Climate Action. And we refer to it as FCCA, and we equip Florida's health professionals with the information, fortitude, and tools to educate colleagues, patients, and lawmakers about the health effects of climate change. We collaborate with partners to create and advocate for equitable solutions that build a healthier, more resilient Florida. So through FCCA, I've been collaborating with the Florida Institute for Health Innovation to develop an online environmental health hazard hub, which will also include information about heat and air pollution. The hub will be hosting a convening next spring to update public health professionals and other stakeholders in Florida about environmental health hazards. I participated in the Miami Climate and Health, or I still participate in the Miami Climate and Health Equity Coalition, the Miami Urban Heat Research Group that you all know and have been active in. It's health professionals, researchers, and nonprofits all working together collaboratively. And I sat on the advisory board for Broward County's 2021 Climate Change Action Plan. Finally, I have been working with the Women's Fund on their heat and pregnancy awareness campaign. That was great. You guys are awesome, get the job done kind of women. And I am a friend of Sky Wheeler's. She invited me recently to be on a planning committee with the Women's Black Health Initiative and the Moms Clean Air Force. The March of Dimes, I think, initially helped organize that. So it's another great collaboration. And this is to hold a congressional hearing in May to support the Omnibus Act, which was sponsored by Representative Underwood from North Carolina. It's specifically to improve Black maternal health outcomes, including heat exposure. So that's really exciting. And my final pet project right now is a collaboration with the Southern Alliance for Clean Energy, the city of St. Petersburg, and I hope to bring on Miami. in the future. And this is a program that would provide free transportation using only electric vehicles to provide healthcare services for children and expectant mothers who have limited or no transportation. The program's called Green Cars for Kids. So thanks a lot. I'm glad to be here.
You have people, Dr. Toms, in this plaza who are gathered here today. You just fell on many of the right ears, many of the right ears. So all of us here today, Miami Foundation, all of these folks who are here today, we have people from FIU, people from There's so many ears here peeled to what you all have to tell us now and what you're seeing. What are you seeing? What are the emerging needs? What are the issues in less than 3 minutes? Because then we'll talk about them. Tanisha, it's all yours.
Yes, so a couple of issues that we found that are of concern very quickly are the March of Dimes, of course, focuses on preterm birth rate. So the preterm birth rate among Black women is 49% higher than the rate among all other women. And when you look at Miami-Dade County, 10% of the total number of infants born in Miami-Dade County were born at preterm. And this can be seen, the top 10 zip codes with the highest percentage of preterm births are seen in the northern region of the county. Areas such as Miami Shores, Hialeah, Opelika, and Miami Gardens have some of the highest percentages of preterm birth rates. And so many of these communities have a populous Haitian and Hispanic population. And so I think some of the issues around public awareness of women's health would be maybe limited funding streams, because I think this is very important when you talk about public awareness of women's health. Targeting messaging is crucial to mobilizing communities. And so I think there should be more investment in tailoring these messages to these specific communities that have these adverse outcomes. As you can see, these rates are more prominent in certain areas of the county. And so I think that awareness needs to be more significant to these populations. As you know, Miami-Dade County is a melting pot, so it can't be a one-size-fits-all approach. And so we really have to take into account the unique cultural and social norms that impact the way this information is received by the community, especially when you look at maybe the northern counties and then you have the southern counties down by Homestead. Those communities may receive the information differently. And so we want to make sure we're taking that into account and developing strategies to combat that.
So it's Brianna. Over the summer, the National Cancer Institute published an article saying that COVID-19 will impact cancer deaths for the next decade, possibly reversing the United States' 25-year streak in improved cancer mortality. And also a recent article in the New York Times noted that many women are still missing their routine screenings because of their fear of contracting COVID-19 and their eagerness to avoid medical facilities. So cancer diagnoses are down across the country, but it's not because we've cured cancer, unfortunately. Since routine screenings are being put off, there's a delay in diagnosis, which allows cancers to progress to more advanced stages. Doctors are urging all patients to be proactive about their cancer risk and their cancer care, which includes routine mammography. Because of my work in the Jewish community, I look at the question of what is a key issue with a Jewish lens. One of the key issues related to women's health in our community is genetics. You may be familiar with a BRCA gene mutation or BRCA gene mutation. We all have BRCA genes or BRCA genes. However, if there is a mutation in the gene, it increases your risk of developing breast cancer, ovarian cancer, and several other related cancers, including pancreatic, prostate, and melanoma. Why is this important? In the general population, 1 in 500 people have this mutation, but Ashkenazi Jews, so Jews of Eastern European descent, 1 in 40 people have the mutation. And it's men and women who can have the mutation and pass it along to their children. When someone has a mutated BRCA gene, their risk of breast cancer goes up to 88%, and their risk of ovarian cancer is as high as 44, 45%. And just for comparison, the average woman's risk without a mutation for breast cancer is roughly 12%, so 12 to 88%. And for ovarian cancer, it's roughly 1.4% versus 45 for ovarian cancer when you have this mutation. And while my area of expertise is in the Jewish population, I would be remiss if I did not mention that there is an increased risk of hereditary breast and ovarian cancer genetic mutations among people of Caribbean descent. I just read a study published in March by Sylvester Comprehensive Cancer Center down in Miami that found 1 in 7 Caribbean adults who had been diagnosed with either breast or ovarian cancer also had a genetic mutation. So this is not just a Jewish issue. It's not just a Caribbean issue. This is a women's health issue, and we need to get the word out.
Help us, Leonie. How do we get the word out?
Well, today the issues are COVID-19, and it's been really interesting to see that we've also a COVID hesitant community, and that has been fueled by communication. As I said, one of the emerging platforms for communicating all sorts of information, the emergence of new trusted messengers has been WhatsApp. WhatsApp is this cell phone app where folks, and it's been really empowering because whether you know how to read or write, you can send little videos, and that really has a powerful reach because even people who cannot read can access information just through their phones. And so WhatsApp has become this incredible forum platform where misinformation can be spread, really rapidly. So right now our efforts are to, also occupy this space, but with messages and messengers that can be equally trusted. And of course, with the focus on COVID, women, again, who sit at the intersection of poverty and misinformation fueled by faith issues, religious beliefs, and their own traditional understanding of medicine and healing, that gets very difficult because you're fighting many battles, and you really have to bring together partners who are also the trusted messengers. And that means the faith leaders, the medical people who look like them, who speak the language, and not just speak the language, understand the culture. Because speaking the language does not mean that you understand the culture. And so to be really responsive to the cultural beliefs, to not dismiss religious beliefs, to not what they call and not call them, just, oh, these are poor people speaking. It's really critical because you will not be heard. And people can say, well, I had this wonderful program in Creole, but no one understood a word because you're using language that has no connection to people's reality. And so we are, we've never be intimidated by these challenges, but these challenges are there, and we continue to work really hard. Again, the faith, we're very happy to have in our journey continue to collect these pastors, these ministers who understand and who can talk to women, about health, about their children. And so this has been very encouraging. But what I want to note is that the means of communications are evolving, and our women are still behind that tech divide, because beyond WhatsApp, there are other ways to communicate. There are other, and partners provide websites that women cannot access. So if March of Dimes, for example, were to say, we have the answer, go to, and it's going to be usually go to www, and our women cannot access that information, the accurate information. So this is the context.
Leonie, not only did we ask for we sent our Creole translation to Santla, but we'll ask you to always give us that feedback. That works for us, that doesn't. And Maria, it's great. You have a digital billboard. Carolina, it's great. You have a bus stop, but I need it in a flyer. I need it in a card. Same thing with Tanisha. This constant communication is what everybody here needs.
Well, beyond the card, we need a phone number. So
Yeah.
that's been the difference, because the flyer will say, reach us at www, and our people will not. So we need a phone number.
Yeah, well, good. So we'll go on there to solutions. Issues you're seeing, Dr. Toms.
Okay, so the health issues I think are most important are extreme heat exposure. And I would have guessed that Tanisha and I would cross over a lot. So I was agreeing with everything she said. So I'll skip through that pretty quickly, the perinatal health and poor birth outcomes, because she covered it more beautifully than I could have. And finally, indoor and outdoor air pollution. So why are these important? If you go on to the next slide, thank you so much, Carol. Extreme heat's called the silent killer. We know because more people die every year because of extreme heat than any other weather-related illness. The last 6 years are the hottest since we started keeping records, and NASA let us know that 2020 tied 2016 for the hottest year on record. So, and it's going to get hotter. So next slide, thank you, you're great. Even though Miami benefits from the ocean breeze, we suffer from very high humidity. And researchers from the Union of Concerned Scientists have data that shows if we stay on the course with fossil fuel burning the way we are, we'll have an average of 88 days above 105-degree heat index, which is very high. That's the feels like temperature. And that's by mid-century. And by the end of the century, it'll increase to 138 days. But if we're able to work together and cut our fossil fuel consumption in half by 2030, and we're able to transition to a clean energy economy by 2050, we can reduce that number to 60. So it's encouraging. There's a lot we can do. And the truth is we have to be prepared for hotter days no matter what anyway, but there's a lot we can do to prevent it. So at-risk groups, these are older adults because they often have pre-existing conditions and they take medications that make it hard for them to thermoregulate, and they get hotter more easily. Older men and women often live alone, they're on limited incomes, and they often have trouble getting around, they have disabilities. During the deadly heat wave in Chicago in 1995, older people who were socially isolated and lived in the top floor of multi-family housing with black asphalt roofs were more likely to succumb to heat-related illnesses. That's important when you think about planning in cities and what they can do to mitigate heat-related illnesses. Children, especially infants, are at increased risk for heat-related illnesses, and people who work and play outdoors, as well as communities of color. And as this same panel discussed last year, different people, same event, pregnant women are often overlooked. And I'm so glad that you had that collaboration. It's been a great team of just awesome women getting the job done. So urban heat islands are important in the next slide to mention because those disproportionately affect communities of color, and they suffer from the adverse heat impacts of those. They have increased energy consumption, which it causes more out-of-pocket expenses on a limited budget. There's more increased greenhouse gas emissions in urban heat islands, more water use, and also economic costs for municipalities as well. And back to pregnant women, just to review for people who maybe weren't here last year, this is a hallmark study of over 32 million births by Becker et al., published in JAMA last year, that showed that women exposed to high temperatures and air pollution are more likely to have premature, underweight, or stillborn babies, with the highest percentages being those with asthma and Black women. So the second issue that I think is important, we're going to just skip through quickly the next slide. If you just look at that D there from the March of Dimes, if that was your child bringing that report card home, what would you think and how would you react? Probably a little bit more with urgency. So that's what we should do as women to supporting other women. So let's just go through. That's just showing there hasn't been a change much over the years. One thing I wanted to mention is that if you compare the US to other countries, we have 63% more neonatal deaths and 93% more postnatal deaths. But our healthcare spending is the highest in the world, 42% more than Switzerland, which comes in second. So that's a disconnect that I'll discuss later. We need to invest more in preventive medicine, and we also need to make sure we're not leaving out millions of people from healthcare insurance. So let me just go on. Let me see where I am. Let's go to that pie chart at the end. Yes. I think this is really important in connecting back to what Tanisha was saying. So I found this interesting. This is something we can all work on. This is something we can do. Women aren't getting the prenatal care they need to be able to have healthy babies. They're not, first of all, you should be healthy before you get pregnant. That's where insurance comes in, because then you can manage chronic illnesses like diabetes, asthma, things that can make a mom unhealthy and lead to poor birth outcomes for mom and baby. So if you look at this, we have, I forgot the math already, is that around 20% of women are not getting adequate prenatal care. And we need to figure out how we're going to help them get that. Then my next slide is about air quality. So this is a picture of Miami. Miami has pretty good air quality, really. And we got a C rating this year from the American Lung Association State of the Air report. Ozone levels are high, and ozone is created from burning fossil fuels by driving cars around. It comes out of our tailpipes. And so I believe, and also fine particulate matter damage, along with ozone, heart and lungs. And this is all produced by the burning of fossil fuels like gas, diesel, coal, and natural gas. So I would be remiss not to address the root cause of a warming planet, the burning of fossil fuels that accumulate in our atmosphere. And we need to build resilience and create comprehensive adaptation plans. But failing to reduce our greenhouse gas pollution, it's like putting a Band-Aid on a bleeding artery. So we have to get carbon emissions reduced within this decade to stay on track to have a clean energy economy. And the last slide here that I just wanted to mention quickly is indoor air pollution. And indoor air pollution hurts women and children, especially in things like mold and moisture, but tobacco products, smoking, and a big part of it is the burning of combustion appliances. Mainly methane burning, or what we call natural gas stoves. And there are some precautions we can take, those of us, I have one, who have a natural gas stove. I'll talk about that later, but gas stoves produce nitrogen oxides, formaldehyde, carbon monoxide, and fine particulate matter. Those are the same pollutants that we measure outdoors. And the EPA controls to a certain degree, not good enough as I'm concerned, as I believe, but we don't monitor that really inside. And we know that it increases our risk of COVID-19 and probably other pandemics in the future. And it worsens outcomes for lung cancer patients and asthma. Adults and children with asthma have been known to have more frequent emergency room and hospital admissions due to exposure to these pollutants. So I'll stop there.
So now we know we can't unsee it. New news, emerging, new information that I learned so much. Every Impact Collaborative. It's sad about my gas stove, but at least we'll be able to do something about it. Now solutions, under 3 minutes, because we do want to keep on talking and having some time for Q&A as well. So Tanisha, I know you've got an amazing new tool from the consortium. Go ahead.
Hi, so again, just speaking a little bit more about the collective impact work, here in the March of Dimes, we believe all women are healthy before, during, after pregnancy, and if they do give birth, they have healthy outcomes. So just talking really quick about what Leonie was saying about those multiple channels of communication to residents, it's very, very important because this can be highly effective in addressing women's health if it's the right communication method. I think going a little deeper, maybe talking directly to the community would be essential to identify the best communication channels. Like she said, what's up is really prominent. It's really big now, but we want to make sure that, okay, if we send public information, health education through what's up, they have access to it, they know how to navigate it, whether, they depending on their level of ability to do so. However, we want to ensure that with the information that we have is also culturally competent. We have to consider the audience educational levels, religious and cultural beliefs. We have to consider those as well. And so we want to make sure that we're considering all these things when we're thinking about how to better connect with the community and the concerns that they have. Talk directly to the community, maybe do some focus groups and just listen to the community to see what will help motivate individuals better. That's one of the things that we'll talk a little bit more later about the collective impact work. And I just want to say a special thank you to a couple partners on the call, Maria and Carolina from Women's Fund. Thank you so much for serving on our convening team. And we are so excited and we welcome all partners. If you're interested in collaborating with us on the collective impact work, please get in contact with me. I would love to have that discussion.
You got an amazing tool. She's got a tool. It's visual. It's clear. Very, very shareable. Brianna.
So I think the first step is education and access to information about screening, counseling, and testing. When someone has a mutation, they're often diagnosed with breast cancers at younger ages, sometimes before the time you would think to schedule a routine mammogram. There's this notion in the United States that when you turn 40, you get your first mammogram. However, if you have a strong family history of cancer, your healthcare professional may say you need to start having mammography done at an earlier age, or you might need additional screening tools such as ultrasounds and MRIs. So basically, you need to determine and have that conversation with your healthcare professional about what is quote unquote routine for you. At Sharsheret, we do a ton of education and outreach in the Jewish community and in the cancer communities to raise awareness about these genetic mutations and the importance of knowing your family history so someone can make that educated decision about their health. We also have a genetic counselor on staff, so we encourage people to reach out to us or to their local genetic counselors to talk about personal risk and guide you through a decision to have genetic testing done. Most people don't realize that there is a whole process in genetic testing that takes place before blood is ever drawn and after you receive your results. That's genetic counseling, and it's really a critical piece in educating people about their risk. So that counseling and education. And while Sharsheret is not involved directly with legislative advocacy, we are patient advocates. So we provide patient voice in a variety of platforms, including the CDC and pharmaceutical companies. Sharsheret is working to increase the frequency and clarity with which we discuss cancer genetics. So we teach women to advocate for themselves. This all circles back to education. All too often, women go to their primary care doctor or their OBGYN and never mention family cancer histories, or they don't think to have those important conversations with family members about who had what diseases at what ages. So in the Jewish population, particularly, we have generations of family health history that were wiped out by the Holocaust. And so women don't have that full picture. So there's many factors involved. And while women who have a known family history of cancer might know to get that annual mammogram, since gene mutations are linked to other cancers, without appropriate conversations about genetics, a woman might not realize that her aunt's breast cancer and her grandmother's ovarian cancer might be a reason for her to see a GI about a colonoscopy or a dermatologist for a routine check for melanoma. That's why we need to put a greater emphasis on community education. And I'm also not just talking about educating the Jewish population. As important as it is to make sure patients know what questions to ask and how to advocate for themselves, it's critical that we educate healthcare professionals about the issues that our high-risk populations are facing. One solution Sharsheret is currently utilizing, and Tanisha mentioned the trigger words, cultural competency. We offer cultural competency trainings for cancer centers and for medical offices, so they are not only aware of statistics of gene mutations in the Jewish population, but also the nuances of our Jewish community. So if a Jewish woman comes to their practice, they know what questions to ask in order to provide the best possible care and what screening or testing options they can offer. So as far as solutions, education, both for patients, community, and for healthcare professionals.
Amazing. Leonie, should we show the little tool first? Would you like to go ahead? So a solution here. Video works. Hit it, Vivi.
Well, I did it.
I did it. Of course I did it.
That's right, I did it.
I did it to be part of a movement.
I did it for our community.
I did it right before I went to work. At first I was skeptical, but I did my research, so I did it.
I did it to be an example para mi gente.
Lo hice!
I did it.
I did it too.
I wanted to get back in the kitchen, so I did it.
I did it so I can hug my family without having to worry.
I did it so that we could get back to worshiping together.
I did it because I missed my students.
Of course we did it.
I did it.
That's right, I did it. I got the vaccine.
There's a lot of hesitancy, but I want to encourage you.
I did it to be an example for the Haitian community.
Muy fel.
I did it.
My mom did it.
I did it for my granddaughter.
I did it to protect myself and others.
I'm one of the first that did it.
And now I'm helping others do it too.
Now let's do it together.
Find out how you can do it at ididitsfl.com.
Solutions, getting messages to people where they are. Leonie.
Yes, for us, absolutely communication is key, but communication is also complex. It involves multiple parts. One of the first one is partnerships. You know, it's really being, because we know that we don't have the resources to do it ourselves. And so partnering with faith-based alliances, nurses association, doctors association, millennials, we have built this absolutely strong partnerships that allow us to communicate messages, check each other on our messaging. We have one partner who's doing a mental health fair, and of course, ask people to register to Eventbrite. So I had to say, look, and then happening, you need to give an address because not everybody's gonna go register to Eventbrite. We also, in addition to sort of being monitors and advocates for, to educate folks about the fact that our community does not access information the same way. And we've seen it through pandemic relief, where most of the rental assistance was done online. And so most information, even by friendly, partners, everything was done online, which in our opinion has really left a lot of people behind, particularly those who have not yet bridged that digital gap. We also have decided to blaze our own trail and create a program called Let's Talk Tech, really focusing on low literacy, low language, no English speaking skills. And, these folks, men and women, who need to understand, who need to bridge that tech divide. So we have, with the support of the Miami Foundation, we have created our own program. We've created curriculum, and we're very excited about that. That course is taught exclusively with the phone. We're hoping to get tablets soon. Through people, our participants come with their phones, and they really learn how to navigate the web, how to find translations, how to even ask for, one of the first class was talk to Google and talk to Siri. So they were extremely excited to be able to control access to information and to understand the tools that had been completely unknown to them. So, in addition to building our partnership, building our YouTube channel so that, when people go on WhatsApp, for example, they land on a site that gives them accurate information, is also a work in process. But the last thing that we have to do, again, in partnership, is to create language. Because as I said before, when you're doing translation, when you're translating difficult concepts that don't necessarily exist in your home language, you have to use a language that empowers, that does not make people feel overwhelmed. Because let's say you talk about climate change, the narrative is so, negative sometimes that people, and I've seen it, when we try to talk about climate change using, sort of translating the terms that are used, people just go, God is good, Jesus will protect me, end of conversation. And so we need to create language that also communicates these concepts in a way that doesn't frighten and force people to withdraw to what they know.
Dr. Tom, solutions.
Well, I did it.
I did it.
I like that video. It's good.
It's awesome.
So,
Thank you, Carrie Ann Royce from the YWCA for sending it over. Stronger together.
Cool. So I have a lot of ideas, and also I have to say Miami is really a leader right now. And I think that this group had a lot to do with that. I mean, it just inspires me what a spark can do and what some really determined women can get accomplished when they group together. So sorry for being redundant, but it's wonderful. So when it comes to heat, we need, well, first let me go back and just talk about ways that we can make solutions. You can do it on a personal, individual level with your family, community, state, federal, and even international impact, as we will see with Miami's heat awareness campaign, that this will have a big impact. So we need to increase those awareness campaigns, and policies need to be put in place. We clinicians need to keep on educating other clinicians and vulnerable populations, and especially the public health workforce. I think that is a gap that needs to be addressed. And reach out to populations where they are, and inform not only patients, but also their families about the health risks of extreme heat. So really, all heat-related illnesses are preventable if you go on to slide 15. So it's very simple. The CDC has a great scheme here: stay cool, stay hydrated, stay informed. When it comes to staying cool, be inside if you can, and have air conditioning during the hottest part of the day. That's important for pregnant women, but also elderly and everybody. If you can avoid that hot middle of the day heat exposure, it's good. Cool showers or baths are a great way to cool down, especially for outdoor workers and their employers. I'll go on to that, need to be informed of things like that. This outdoor workers should also be given ample opportunity to rest, have access to cool, drinkable water, and shade. So pregnant women should also, go back to the one before. Pregnant Pregnant women should also remember that they need to rest, wear light colored clothing, and stay in the shade when they're outside, wear a hat. So staying hydrated means follow basically, unless you have health conditions that would restrict your water intake, or you're taking medicines like blood pressure medicine or something for depression. Perhaps you need to talk with your doctor about the right kind of water intake, but basically just water, no caffeine or alcohol. The 8x8 rule is 64 ounces, 8-ounce glasses of water a day. It's important to stay hydrated, especially for pregnant women, because that can trigger labor, and through a mechanism that we don't quite understand. There's a hormone called ADH, which when we're dehydrated, we produce, that looks a lot like oxytocin, which is a very potent labor-inducing hormone. If you've given birth, you might know that. And they're not quite sure. Maybe oxytocin is made in the pituitary. Because of dehydration, we need to do more research. That's another thing. And staying informed is important. Tune in to the weather report, check for heat alerts or warnings, and really know what the temperature is. Another thing you can do is re-acclimate. So if you get used to going out in the weather, in the winter and the spring, your body will slowly acclimate. Make sure you go out in the morning or late afternoon, but and stay out of the sun in midday. Another thing, know the signs of heat-related illnesses, so that you can take precautions first. If you're developing a headache, get out of the sun right away. Those are important things to stop them from happening before you end up in the emergency room. So then I think we can go on to the next slide. So as I said, these are all preventable, but we also need local, state, and national elected officials to be better at communicating these dangers and getting this out to the public. We also need Florida, the state of Florida, to adopt a comprehensive heat action plan to reduce heat and improve the ability of residents to deal with heat. So there are great tools out there already. The Florida BRACE program. BRACE is a program that is funded by the CDC. It stands for Building Resistance Against Climate Effects. There we go. And they have a vulnerability assessment plan you can use. The Southeast Florida Regional Climate Change Compact has a climate action plan that can cities and Florida can build on the information that they have on health harms of extreme heat. New York City has a great Beat the Heat campaign that has things we can model, and the state of Arizona has been fabulous in helping to safeguard its citizens from heat. They have to, and Arizona State University has done a lot of research. Not only that, but our own University of Miami and FIU have some terrific researchers that are doing great heat research right now. And in fact, they're starting a new research program that you as a citizen can be involved in. And I would highly recommend it because you can learn a lot about your community and which communities are the hottest. They're going to be deploying iButtons in the city in May, the end of May. And this is through the Urban Heat Research Group in FIU. And you can help get these buttons out, and you can help go and pick them up and collect them so we can look at the data and actually pinpoint on a smaller scale where the hottest areas of the city are. So also there is no state requirement for protections against outdoor workers to make sure they have adequate shelter, shade, food, shade, water, and rest. And this is a great little app that you can download from OSHA and NIOSH. You can just Google it, heat index app, and it gives you all kinds of information that can help workers and their employers protect against heat-related illnesses. But I do think that we need to have some sort of plan in action, either federal at the state level, to protect outdoor workers against heat because they are extremely vulnerable. Let's see, in the city of Miami, Chief Hevia and the emergency manager in Miami has been working with the Miami Women's Fund to kick off a heat awareness campaign May 28th. I think Maria mentioned that. And Mayor Levine Cava has also kicked off a new initiative funded by the Adrian R. Rockefeller Foundation Resilience Center, and is starting a new position of Chief Heat Officer that Jane Gilbert will be taking over, and she'll be leading a heat task force with FCCA's own Dr. Cheryl Holder, and they will be working on ways that you can mitigate the effects of extreme heat. Some of this, when you look at urban heat islands, I think Miami is already working on this, but I'm sure they'll be continuing it, planting trees and vegetation. It also helps with flooding. So it's bang for your buck, helping with extreme heat and flooding during hurricanes especially. We can also build in green roofs, and cool roofs have been shown in research to be the most economical. Green roofs are a little more expensive and you have to maintain them. So really it's those black asphalt roofs that are so deadly and heat up our cities. So there's research and there are lots of recommendations for painting these roofs with a white reflective paint that keeps inhabitants inside cooler. Also weatherization programs that help support low and middle income residents to be able to get better insulation, new windows and doors, maybe even new energy efficient air conditioners. There's a great program called the Solar Energy Loan Fund that I believe is going to be coming to Miami. It's a kind of green bank that lends at low cost to low and middle income residents so they can help lower their electric bill and protect against extreme heat inside. So let's see, if we go, I kind of went a little bit fast there and didn't tell you. If you go to the next slide, then when it comes to addressing all three of these things, maternal health and heat and air pollution and fighting COVID, I believe that one of the best ways to guard against all of those is by adopting Medicaid expansion in Florida. If you see, we're only one of 12 states that has not yet adopted Medicaid expansion. And this is costly.
That's important. That's important. We're going to have to go really quickly, Dr. Thomas, otherwise we're not going to have time. So I want you to make those points, but I'm just giving you a heads up. It's been so interesting today. Just sharing.
We can talk about that in the discussion. This is a really important issue, and the time is now. We can literally save $200 million a year by just the programs that they have now, and it will increase to as much as almost 2 billion when you add up everything, and that addition includes a lot of different things. So if we go on, I know I always like to know what can I do. So as an individual, so I have these Trifecta Solutions. They're good for your health, your wallet, and your community. So the first one is to transition to electric transportation. If you can, walk or bike, buy an electric car. They're more affordable than you think, and there are a lot of used ones on the market now. There are tax credits as well. You can carpool and advocate for more transportation electrification. The second way is to choose and advocate for clean energy, rooftop solar. If that's not an affordable option, although they've gotten much more affordable, you can join FP&L's Solar Together program and advocate for clean energy policies like the 100% commitment to clean energy that South Miami Beach has already committed to. So these are just really cool. They show you the cost of fossil fuels, and they also show you, including healthcare and the greenhouse gas emissions. It is pretty overwhelming when you compare solar and wind to coal, oil, and natural gas. All you have to do is look at the picture. This one is also compelling. The cost in the last 10 years of solar and wind have dropped really low. So clean energy is coming. It just needs to come quickly. The last thing I want to mention is you can go vegetarian, eat less meat if you can't go vegetarian or vegan right away, and buy local produce or plant your own garden. And the last slide is woman power. It's much too good to waste, and we can change the world if we work together, guys.
Amen to that. Amen to that. How do we make all these incredible tools into common knowledge, and how do we do it quickly? So Jennifer, we're going to ask you, Dr. Chickett, to join us as well in this kind of quick Q&A back and forth. Brianna, I'm going to ask you to look at the first Q&A question, see if you know the answer and can type it because it's very specific.
Sure.
And I'm going to go to the second one. And thank you, Sandy Scalani, for that. You're amazing. There's so many amazing people here today. So our board chair, Gloria Romero Roses, and one of those slides, Dr. Toms, that you just put up. So Gloria is saying here, and I'll read it, what you could read yourselves. We've been following the broad outlines of the components that make up the American Jobs Plan and the American Family Plan. Have any of our panelists seen more details of the possible new federal dollars that are being proposed for closing the access and education gaps so that we may be intentional about advocating with our elected leaders while these bills are being debated? Who would like to take it? Can I raise a hand or?
It's the education and access gap, access to education for just general education, access to healthcare. Is that it?
American Jobs Plan and the American Family Plan. Yes.
Well, I think that we need to, there is no cookie cutter solution. There are, women in different communities have different needs. And I think that it's really important that we understand what these differences are, in order to advocate for the right solution and the right fit to the specificity of needs in community. I think that we must, as we advocate, as we speak on the, to government, understand that there are different solutions depending on the community, and that needs to be understood and articulated.
Okay, does anybody else have any? We don't have to know. Gloria, I think we might need to count on you and the Women's Fund and leadership here to find more about that.
I have a little bit of an idea. I think what she's getting at is maybe advocating. And, I don't know how many of us in this group have advocated, but I have been recently, and it's not as hard as you think. You can contact your federal or state representative and you can tell them what you want. You can follow them. The legislative session was just in Tallahassee. And really, we need to speak out. I'm telling you, there were bills passed that we really don't want to have that infringe on local Miami's right to push for clean energy. The bill will be law if the governor signs it. I don't know. I don't think he signed it yet, but you can definitely contact your governor and Governor DeSantis and tell him that you don't want House Bill 919 passed. It infringes on local municipalities' rights to determine how they use their energy and keeps you from moving toward 100% clean energy. That's really important.
Daphne, hello, another board member. Is there data specifically for women migrant workers regarding effects from working in the heat all day? And what about handling produce with pesticides? What's their mortality rate? And how can we better advocate and hold those accountable in order to protect our migrant workers? I know the people from We Count were going to be here as well. Some of you in the audience might know as well, so feel free to post in the chat if you've got any answers. But who of our panelists would like to take this up? Is that for you again, Dr. Toms?
Well, I do know that she just touched on a very important issue, and there were studies in Mexico that first sparked this. There is a high rate of kidney failure and kidney disease among outdoor workers, farm workers in particular, and it's thought that it's a combination of dehydration from working in the heat and exposure to pesticides that causes this kidney damage. And it's increased dramatically. I forgot the figures, but it's just overwhelming. It's something clinicians need to be aware of. Of course, nephrologists are aware of a lot of it. One that is within FCCA is very concerned with it, but that is important, and we need more information out to employers so that they know. I don't think most employers willfully want to put their workers in harm's way. Acclimating for new farm workers, if they're new, they're most at risk of heat-related illnesses, and they should slowly work, starting in the morning for a couple of hours and then building up from there. So those are important steps.
It's very interesting in the chat. Gloria Fonseca, I think, is a female business owner, and she works with toxic paint. She was, commenting in the chat there, that information out of how can good people do the right thing. It's so essential. One of the really interesting things that we talk about is every time we do an impact collaborative on a similar topic, things change, right? The conversation is not the same today as it's going to be a year from now on all of these issues. There will be different funding. Will we have landed some of the funding that Gloria is referring to here? How many people will take the toolkit that Tanisha has developed, and how many people will use it? So in this poll that we've created, many of you have had the opportunity to say, yes, I would like to speak with Santla. I would like to be in touch with March of Dimes or with the consortium and the Coalition for Health, right? People would like to hear from Dr. Toms or speak with Brianna directly, get services. I mean, Debbie Bustle also, I don't know, Brianna, if you saw the statistics that are there for Caribbean women in the chat as well. It's pretty striking that I didn't know that until Debbie Bustle said something to me, about 2 months ago. And then you said something to me this month. This is emerging. We're all very well educated and caring individuals. Many of you here today are really important leaders. I don't know if you all saw that we have the president-elect of the PTA here today. You see the cross section from Miami-Dade County, which is a huge county, of people here from the north, people here from the south, people from the west, from the east. It's really amazing what can happen when we do stay in our proverbial lane, so we get the depth of the information that all of you have presented here today, but then share it and amplify. Tanisha, I'm going to ask you to just briefly just tell people what your little toolkit is and where they can find it.
And so, yes, the toolkit that we're forming, it will be up for distribution soon. However, we're just the main point of it is to ensure that we have a common agenda. And so once we have that common agenda worked out, we will definitely share it widely, because we want everyone to be on board as far as that shared goal in the work that we're doing to reduce preterm births and maternal mortality within the county. So I'm so excited to work with everyone and get feedback from everyone, because again, this is a collaborative work that we're doing. And we want to make sure that we have everyone's valuable input because everyone can make a major impact on these rates.
And can you tell people how they can join the consortium? Because I didn't know before. We're on many coalitions. We're in South Florida Human Trafficking Taskforce, the domestic violence. We work with so many different people, but I didn't know about this one until now, and it's exciting to be.
Oh yes, yes, I understand. Yes, actually, you know what? I'll see if I can put it. I'll send it to you right after, and you can distribute it. Yes, it's the social media toolkit that the consortium, the Healthy Baby Task Force, within this consortium of Miami-Dade, created. It's a social media toolkit, so it's really great. It's very, very, very filled with great information that is for organizations that you can push out on your social media. It has news articles, facts. It has great resources, a lot of partners that you can connect with. And yes, so I will definitely send you that information. So if anyone is interested, they can join our meetings. We meet every third Friday of the month from 12:30 to 1:30, and we welcome any and all of our partners to participate. So yes, I'll send that to you right now. You can send it to everyone.
Amazing. Well, Jennifer, welcome back. I'm so sorry. We promised to everybody we are going to share quick that we do end sharp at 10:30. We're inviting everybody to stay connected with the Women's Fund, not only the first Thursday of every month for these amazing meetings of the minds and gender lenses, but we also have a way to just put your QR code, your phone to the QR code and become impact agents and become even more involved with the Women's Fund. We will have an exit survey that's going to pop magically into your inboxes. I'm going to be hanging out tomorrow afternoon and on Saturday because this really groovy, peaceful, beautiful brand, Boom Shanti, who supported us for Power of the Purse, said, come on, it's Mother's Day. Let's do another event. So I'll be in South Miami hanging out, buying things for a cause, benefiting us. So come and see us there if you'd like. And next Thursday, June 3rd, next month, Thursday, June 3rd, we're going to be talking about our Freedom from Violence pillar. And we're going to focus on violence and how it is engaged with incarceration and those ties. We've got some fascinating looks at that. So we welcome you all back. Stronger together. Thank you all for being here. Unmute yourselves. Panelists, thank you, thank you, thank you.
Thank you.
Thank you so much.
Thank you.
You mentioned Jane Gilbert, Dr. Tom. She was on the call for a big portion of the time.
Oh, great, great.
Yeah, lots of folks here.
Thank you so much.
Work. Leonie, so good to see you. I can't wait till we all see each other in person. I think we'll probably have to do it mixed. So more people come when we do it virtually, but we'll also start meeting in person again one of these months or years. So we can do some hugs and then some virtual, a little bit of both. Jennifer, there's so many questions I still have for you. I think, are you frozen? Jennifer's had some tech issues today. Yeah. I have a feeling we might be putting some media your way, Jennifer. And to all of you here, we had some really interesting conversations with the leadership at the Miami Herald right after our Impact Collaborative, and everybody was there together, or excuse me, our Power of the Purse. They were there and partnering with us, and they were talking about how important it is for all of the, the truth in reporting and vetting and getting the real information out to people. So, like you've all been saying, Leonie, you said, so much of this false information, who your trusted sources, and then all of that coming from somebody who's really harming. And what Jennifer was showing, these like shadow or, ghost or mirror, the false narrative sticking in the activists. So, I think many of you might hear from different media through us as well. They're often asking us, like, who's looking at this? Who's doing that? We're hearing these issues. What are you hearing? So in advance, thanks for all staying connected in that way too.
Yeah.
Vivian?
Our future is audio-visual. Information has to be audio-visual in Creole for us.
like that video, having Gypsy on there, right? Having
Right.
the different people that you know and you trust. I mean, how long have you been working in the community, Leonie?
Oh, over 20 years. And as you can see, the vehicles for information, for communications have changed, right? Before that, it was exclusively radio, and then it went on to radio and TV. Now it's not necessarily Facebook, Instagram, and Twitter. I mean, the majority of our young people are on the net and are definitely technologically savvy. So I need to clarify that the population that I'm talking about is the population that we serve is, mostly low income, limited education folks who need access to information and who are not getting it because they just don't have access to the internet. They don't, a woman cannot register her child to get free books and the book. I mean, there's so many people who come here and I have to actually create an email account so that their child can get a free book a month from the Children's Trust Book Club. That just something as basic as that, is this technology is really, like, basic technology is a major issue that impedes access to critically important information.
Miami Foundation is working on that. I love this after party, by the way. I love this after party. I promise we're done at 10:30, but yeah, the Miami Foundation is really working on getting that tech out. We have an amazing community. I don't know if it's just because I'm more involved than I used to be, but boy, this community growing up fast. Don't you feel we're all more interdigitated than before?
It depends.
Lots of work to be done.
It depends, yeah. Yeah, absolutely. And we are.
Well, Vivi's got, Vivian Caro, so here we are, the trio. Iris, you're getting, Leonie, you're getting some in the chat.
Yeah.
Help.
Yeah, well, yes. And I just thank you. But I just want to say again that basic means, we're not using well, I'll talk to you and just
great.
tell you.
Yeah, I was thinking maybe we can connect with Joanne and I have my mind is rushing with ideas right now. So we should definitely do something because this is important for everybody who's doing community engagement or advocacy, or, we have to pay attention to this. And it's not only for the Haitian community, but also down in the farms in Homestead, all those, yeah.
That's what I was going to say. As I speak about it in different forums, I get approached by the African American community. They're saying our people got shut out of some of these COVID funds because they couldn't upload documents online, because some of these applications require you, and the assumption from the folks at the county and the cities will say, well, they probably have kids who help them. Well, that's not always the case. So and when you send people, fraud is a major issue when folks have to ask others to help them, because you have to give out your personal information. And so that affinity fraud is rooted in these issues and so it happens to not just the Haitian community, but multiple communities. And it's very serious, and people don't necessarily understand what that means.
For the elderly also.
Oh my God, yes.
Yeah, I just want to say something really fast, because we saw that a lot when I was doing navigation for Marketplace. There were, for health insurance in the Marketplace, there were so many people, and whether it be they were seniors or there was a language barrier, there were so many people that had accounts created that they didn't even know about, or they went to someone and they didn't give them the information to follow up on. And so people were signed up for plans that they didn't even use, and they were charging them monthly, and they didn't have an insurance card, they didn't have anything. They were paying for something they didn't have. And then the issue was they didn't have the information to close the account. So they're consistently being charged for something where they can't use it because they don't have the card. Whoever helped them, whether it be a broker or a friend, they can't get in contact with them anymore. And so that was really, really a big problem, because as navigators at that time, it's really hard to help that person because we don't know where to start if we can't contact the person that helped them.
We can't even get our old LinkedIn gone. You know, we can't get into the Women's Fund LinkedIn. So most, you know, people are following the wrong place. We can't even get into it. And we have a bunch of people who care and sophisticated, and we hire somebody to help us. You know, we have, I mean, if we can't.
And it costs a lot of money. I mean, for people to go get that medical information, to get unemployment. And then that's why Santla had to remain open to the public even at the height of the pandemic, because we still have lines outside. You know, we serve like 200 people a day, helping them with unemployment claims, because all of these things are only accessible online. And so we had to do something that we're not technically even funded to do, but we had to, because it was the pandemic and folks were being unemployed. So it's a major issue that we're not really facing, because we only think that folks are not connected. You know, people will cite me the data that 37% of households in my community are not connected to the internet, but they're connected via their phones. So bringing connectivity may be an issue if the kid is home and wants to learn, but in terms of the parent, if they have the phone, there is connectivity, they just don't know how to connect. And so it's amazing. I mean, I'm just transgressing a little bit, digressing, but I saw a Star Trek episode once where they landed on a planet and there was this huge fight. You know, there were those who were connected and those who were not. And those who were not were sort of the wretched of the earth. They were presented as, you know, living in, you know, tawdry housing. And then the connected were just flying off, and they had no clue that these folks had access to nothing. So that always reminded me, I can't find this episode, but it always reminded me of what we're dealing with right now, and no one knows. No one understands how debilitating that is for families not to have access to critical tools now. You can't survive if you're not connected. Period.
That's why we need to keep on talking and identifying these emerging needs. What the Miami Foundation is doing, a lot of this stuff is amazing to try and address that. Even you know, the county mayor looking this Thrive 305. What do we need? Tell us, because these things are not the same this year as they were last year. They're not. We need to keep on talking. So selfishly, we want to ask your help with all of your help with two things. One, really specifically on those billboards and bus shelters that we have right now. There's no question they need to be changed, upgraded, amplified. So yeah, it's one thing, you know, Gato and Vivi and I are all running around looking for some funding for the next set of billboards. But the call to action, I mean, we have a 911 on there, and we did ask so many professionals, like, is that, you know, should we have it? Yes. So there is a number that can be called if people are in extreme duress. But for the informational part, I mean, thank heavens for the amazing Chief Robert Evia, who added that pregnancy information to the city emergency website, and people will get to it if they use our link. But if you're just kind of looking for it, it's deep. It's not easy to go to. And usually people look at emergency websites for a city when a hurricane's coming to their city. They don't think of the #1 killer, you know, weather-related killer in the country is heat. You know, they're not going. They're going because a hurricane with a new name is coming, right? So everything that Chief Evie has done is amazing, but it needs to go to so many more places, right? So all of us need our help, and, you know, and Viviana and Sky Wheeler from Human Rights Watch and Dr. Tom's, you know, between all of us, we can get that information and share what we have. but it needs to be in more places. And Tanisha, I'm going to be very transparent. Bye, Iris. Thank you so much for amazing for volunteering. You know, as we're learning, like, I don't know how all the different mayor's offices communicate amongst each other. So, you know, I go to the county, I go to the city. I don't want to pretend that I understand your village. You know, you all hopefully will speak to each other. Please speak to each other. Please speak to each other. This is what we've got, right? Well, it's the same thing with health, right? So how do we get all of this information out into the public health sector? And we're learning that through this, the, you know, Healthy Coalition, that, you know, we were welcome to join, but we didn't know. But hopefully you can help us introduce that quickly and get this information out. And if there are places that are better, you know, we can have, you know, Carolina and I can work with the design team, and they can give 10 different organizations our same logos, our same artwork, our same everything, but you can put in your own link, you know, if you're going to put it on your website. So go to my page and listen in my language, in my, you know, whatever, to, you know, to this updated information and what you do, right? These are things we can all do.
Maria, that actually, I'm so glad you suggested that, because I was going to ask you. FCCA has applied for grant funding, and hopefully we'll get it for a new program that Dr. Holder developed. It's called CHOT, and it's in the summer, where you have high school and just a few high school and college students going out to federally qualified healthcare centers and talking with the staff first and letting them know about, just quickly, about the health harms of heat, and asking if they can put up posters and flyers. Could we use yours?
Totally. Yeah. Didn't we already say, Vivi, unmute yourself. Enough of that muting stuff. Caro, you too.
Red bit of background noise in my house.
Oh, okay.
Melissa's emailed us, and we're in the works already. It's in the works.
And Melissa's always on the ball. It's like, I'll tell her I'll get to it, and she's already gotten to it. So.
And the heat campaign, it's going to be, we're going to create a toolkit on our website where people can download the images and either print them or share them digitally. So that's also going to be available.
Okay.
I have to jump off, but I just wanted to say thank you again for allowing Sharsheret to kind of piggyback on this program and join this incredible panel. I've had a handful of colleagues have been texting me like, oh my gosh, this is amazing. Sharsharet's never done anything like this. This is really incredible. So thank you for allowing us to participate, to share our story, and to be listening to each of the incredible speakers, because I was just so much to think about for me personally, as a Floridian, as a native Miamian, but also as a community person, and ways that we as organizations can all continue to work together. So thank you.
I'll think about doing it, but I won't end up doing it. Will you write to the Jewish Federation and thank everybody who connected us in the first time? And she's not on, she was on until like a split second ago, Joanne Godoy from Radical Partners, who, you know, they put the engine behind this too. We have to thank Joanne for putting us all together. But really, thank Tiffany Heckler and all those people, because otherwise we wouldn't have met. And I learned so much that day. And we got that, the Jewish organizations who were working with women and girls, you know, I handed that to Viviana, who's doing research on the landscape of what's going on for women and girls here in Miami-Dade County. We learned so much that day, right?
We've had the benefit of participating in that particular think tank for a handful of years. And it's just every year I get a new connection, or I learn something new about a community. I grew up in the Miami Jewish community. So like, I think I know it. I don't know everything. It's just not possible. And so being able to connect, and then that turned into this. So I think I feel very grateful.
Well, we're going to give you all the materials that we have, because we need them to go out as much as possible. And then we need to iterate. If, you know, there's something that works or it doesn't work, you know, we we can fix them, and we can make more. And also, since we're working on this dashboard of statistics of what's going on with women and girls across our community, health and well-being, leadership, economic mobility, and freedom from violence, the different information that you have, the different widgets of research that you have, it helps us to put it together in this stone soup, see if your widgets will fit on our dashboard, or if we can make them fit in the next or the next or the next iteration. And so it gets to be more and more substantial, and everybody can come in, eat from that stone soup of info and current information and who's doing what and gaps and needs. And oh my gosh, I don't need this mental health piece because they have an amazing program, so we can invite them in once a week, who's doing what. So we need to keep connected.
We are doing a program, sorry, I'm monopolizing the moment. We're doing a program in October for women who are over 55 and access to screening. And because a lot of, I mentioned this in the talk, and at 40, everyone knows go get your first mammogram, but then at 55, the information gets a little murky. Do you do it every year, every other year? What if you're at high risk? So we're doing a talk about that in October. That's what the Jewish Federation is giving us funding towards. I'd love to partner on that because I think we can kind of, you grab a different area of a population than I have. So I think, like you said, sharing the information in all of our different areas, it's just beneficial for our community.
And we can do the big public awareness ones too. I mean, a billboard and some bus shelters go a long way. Even if you're doing one, what we call a bulk campaign, you do one, and then you can share those again and again, because you can share that same stuff in digital media, and it can keep on living on. And a picture of a billboard and a picture, those can make the news. Yep. So, and they're not that expensive, with $10,000, we can make some serious damage, and then that can live on and on and on. And different people will support it. Maybe it will be Florida Blue or Jackson Health Initiative or Baptist who supported us on this one. I mean, you never know. I mean, there are so many different people. It might be Sylvester who might say it's a really good image, Yeah.
Well, I'm going to have to go too. I have another meeting to jump on soon. So it was, I'm glad I replaced Gypsy at the last minute. It was a pleasure. And I'm looking forward to more. Thank you very much.
Thank you, Leonie. Great to have you.
Thank you so much, ladies. I really am.
Bye,
appreciate
Brianna.
it. I also sent you, Carolina and Maria, I sent you the Healthy Baby Taskforce Toolkit, and also the Candace, the liaison. You can send her information out to everyone that participated. They can get the meeting details from her, and she'll send it out.
Thank you. Bye-bye.